Hello, our presentation is about a community cat population management program that we participated in this winter. I'm Adele. I've worked with grassroots animal rescues across the world since 2021, especially with high impact cat population management programs.
My name is Layla. I've previously worked in all species sanctuaries in Vietnam and Cambodia, and I've been working within targeted strategic TNR since 2024. Currently, I'm developing a population management program for both cats and dogs in Siem Reap, Cambodia.
Since 2021, we've supported locally led animal rescues and cat population management programs across the global south in 10 countries. Our core activities involve supporting local organizations in ways that help them build their existing capacity, strategize their approach, and increase their impact. Over the last 3 years, we've worked mostly in Greece. And over the last 5 months, Layla and I ran our own high quality, high volume spay neuter program for cats on Lefkada Island. This is where we tested our strategic TNVR model, which is largely based on ICAM methodology, and collaborated with all local animal welfare stakeholders and government to strategically sterilize over 400 cats and achieve an 80 to 100% sterilization rate across our target areas in a limited time frame. Overall, we focus on shifting the animal welfare sector away from fragmented cat population management towards strategic cat population management. And today we're going to share one of those stories.
In November 2025, we were invited to support a TNVR mission for the smaller Cycladic islands of Skinusa, Iraklia, and Kufanisi. It was organised by the municipality, which isn't super common in Greece, so we were very eager to participate. As there was no local veterinary clinic, a travelling vet team would come from Athens to sterilise 250 cats over 1 week. And as there were no local animal welfare groups, volunteers from different organisations would come from all over Greece to catch the cats. Each day, the cats would travel from each island to Skinusa to have surgery, then back to their island to recover for one night, and they were returned to the field the next day. So currently, this is generally how TNR projects are structured in Greece. There are many one-time interventions such as this with no ongoing CPM work, partly due to the restrictions in veterinary access. However, just because a TNR project happened doesn't mean it was successful. Doing TNR without a strategy risks having no long-term impact or sustainability. In order to evaluate the success of a project, we must be able to measure our impact. And in order for that to be sustainable, we must take a strategic approach.
These are some of the challenges we faced with this mission. So, without local veterinary care access, this short-term mission had to arrange for veterinarians to travel from another city to the island to conduct the surgeries. This restricted the time we could run this mission to a week. The catching, transporting, and returning of the cats relied on small teams of experienced volunteers from various organizations who could afford to take a week off from their daily lives to support the mission. Small teams of 2 or 3 people conducted the trapping on each island. With no stock of trapping equipment or recovery cages locally, volunteers brought their own trapping equipment, cage covers, supplies, and sourced plastic cat carriers from other organizations all over Greece and shared them across the 3 islands. While Kufanisi and Iraklia had 4 local volunteers conducting TNR year-round, Skinusa Island had no active volunteers or organizations, which is why catching cats had to be outsourced to us. There was also no data on the local cat population, no information about feeders, locations, or sizes of cat colonies. Temperament of the cats was also unknown. If we were going to use data to inform our strategy, we'd have to do the research ourselves. And as this was a short-term project and we did not live locally, we wouldn't be able to do continued monitoring or maintenance of the cat colonies after the mission. This meant we'd have to go all in during this week and maximize our sterilization capacity, trying to ensure Skinusa was completely sterilized by the end. So our capacity for the mission was around 50 to 60 cats per day across the 3 islands, 2 to 3 cat catchers per team, 2 veterinarians supported by 4 vet assistants and the admin team, and each cat would have one night of recovery after surgery before being returned.
So, based on the challenges that Adele listed, we structured our goals and we chose the strategies that we would need to achieve a measurable impact. Ideally, a sustainable CPM program doesn't happen once and it doesn't rely on the work of an external organisation. Even though we had these restrictions, a huge benefit was being able to work with a local municipality led by a very motivated vice mayor who was organising the mission. We could demonstrate to him the impact of a strategic approach, which they could then implement themselves going forward. And so we decided that our goals were to conduct an intensive survey, establish a cat population count, create a cat colony map, sterilise as close to 100% of the cats for lasting change, sterilise all cats of reproductive age. The current standard in Greece is 4 months and above. Provide the municipality with a database of all the remaining intact cats and their locations after the mission and a timeline within which to repeat the mission. Create an impact report. And lastly, recommend a future plan and strategy for their island.
So the last sterilization program on Skinusa was 3 years prior and was fragmented, resulting in the sterilized cat population decreasing while the intact cat population increased since then. Currently in Greece, TNR usually occurs with a reactive approach rather than a strategic approach, and this could be why. Reactive TNVR looks like volunteers trapping and sterilizing cats from many different areas or colonies, or organizations responding to requests for help sterilizing cats from all over an area, or municipalities inviting the general public to bring cats for sterilization from all over an area. These approaches often result in a low sterilization rate of cats in each colony, with continued reproduction, migration of intact cats, and widely spread efforts and resources. This approach often results in fragmented programs that lack long-term impact or sustainability. With this strategy, there is no finish line or handover point to the local community. However, with community level or colony level TNVR, this looks like working colony by colony or area by area before moving on to the next one, as well as geographically targeting the places we work in to be close to one another to prevent intact cat migration, planning ahead and choosing target cat colonies and areas for strategic reasons, not reactive reasons, and connecting with the locals in each community to work together and build their capacity to continue these activities long term. In this way, our efforts are controlled and decided, and we maximize our limited resources. This approach often results in a high sterilization rate in each area with an empowered and informed local community. This is what we chose for this Skinusa project. We needed to quickly produce a high-impact intervention that created a stable cat population. This meant we worked colony by colony, sterilized each one to a minimum 80% with a target of 100%, and kept returning until every last cat was sterilized, including kittens of 4 months or older. We then moved to community-level targeting, working village by village. We targeted the largest colonies first to front-load the work, which gave us more time to revisit each colony, monitor for intact cats, and catch the evasive last ones. In order to do this kind of targeting, we first needed to do research, collect data, and create a plan. We requested from the municipality to arrive a few days before the vet team so that we could conduct our survey. We conducted an intensive survey with an experienced cat population researcher from a fellow Cycladic CPM program in Paros and Antiparos. We spent 2 days mapping colonies and counting cats of the entire island, as Skinusa is quite a small island. This typically isn't possible for organizations to do as it's labor-intensive and time-consuming, which is why most organizations conduct a transect survey instead. However, as we needed to begin trapping in 2 days' time, we had to find every cat and colony on the island to directly inform our catching strategy, and we couldn't rely on a randomized transect survey for this. We used GeoTracker to map our surveying route and make sure we covered the whole island, and we used Google Maps to pin the location of every colony. And each colony was assigned a name. We divided the island into 6 target areas and surveyed them one by one. When we spotted cats, we stopped and entered their colony data into a Google form. We collected their exact location, time of sighting, sex, age, health status, temperament, feeder status, and feeder willingness to sterilize the cats. While apps like Talea are a great resource for surveying, we needed to collect data at the colony level and not on individual cats, which is why we created a customized Google form to be able to do that. This form connected to a spreadsheet which we used to analyze the data and upload to Google My Maps, along with our GeoTracker data, which created a custom map for the survey, which you can see to the right. By counting all the cats, we knew how many sterilization slots to ask the municipality for from Skinusa in order to meet our 80% sterilization target. And thanks to this research, we received the 100 sterilization slots that we needed, while the two other islands included in the program were recommended to catch and sterilize fewer cats.
Using our pre-survey data and map, we worked colony by colony, revisiting each area at varying times throughout the week. We trapped and sterilised 96 cats on Skinusa over that first week, and with 91 and 53 more cats coming from the other two islands, a total of 240 cats were sterilised throughout that mission. Every trapped cat had their own cover and label. Every individual received an ID number associated with their exact location to ensure that they were all returned properly. By collecting data throughout the trapping phase, we could calculate individual colony sterilisation rates with the number of cats we sterilised and the number of cats we knew were left intact. They included kittens who were too young to be sterilised, so under 4 months old, cats who we couldn't capture in time, and also some sick cats. Based on our data at the colony level, we knew half of the colonies were at least 80% sterilised, and 2/5 of the colonies were at 100% sterilised.
Our pre-survey data told us that back in 2023, after the first sterilization mission on Skinusa, the cat population was at 31% sterilization. After our intervention at the community level, we knew we had achieved a 79% sterilization rate across the island by comparing all of the data from before and what we collected now. With this information, we were able to measure and demonstrate the impact of our strategy, which we presented to the municipality while advising them to repeat the mission in 2 months' time. This recommendation was based on data we had from other CPM programs in Greece, combined with the data we collected here, where we have seen trends in mating seasons, average litter sizes, and typical ages of cat reproduction. We knew for the mission to be most effective, the kittens younger than 4 months would have to be sterilized in 2 to 3 months' time, and adult females would have to be sterilized before the typical February-March mating season in Greece. This would ensure the cat population would reach as close to 100% sterilization as possible by the time we left. But without returning to the island to finish sterilizing all of the cats, our work would have very quickly been undone, and our resources would have been wasted.
2 months later, in January 2026, we were invited back to finish the island, again with volunteers from other parts of Greece. Using our previous research, we caught the remaining intact cats and kittens we had identified in November. We finished several more colonies, bringing the total number of colonies sterilised above 80% to 29 out of the 39 that we worked in. We've only identified 12 more intact cats that we couldn't catch due to difficulties, such as local community members keeping them inside, or the cats being too young or too sick to be sterilised. We then travelled to Iraklia and Kufanisi to support the local organisations, and we helped them by trapping difficult and evasive cats using our drop trap, which is a rare piece of equipment in Greece that's vital for finishing colonies. The difference between trapping on Skinusa and Kufanisi was clear, as on Kufanisi we had no map of the colonies and we didn't know how many cats were left unsterilised on the island. Without the time to survey beforehand, we had to just go into the trapping uninformed. We were much less productive than on Skinusa and we caught fewer cats. We also couldn't produce a sterilisation rate or a recommendation plan for their island. Therefore, we don't know if we were successful overall or how many unsterilised cats are still left on the island.
To us, this project demonstrated the important role of research and data in creating a strategy for an impactful CPM program, especially when we compare the various islands and our approaches and impacts there. This allowed us to collect the data we needed to measure our impact, set realistic targets, and design recommendations for the municipality going forward. The reason this worked is that we followed a protocol on Skinusa: research, plan, strategize, act, monitor, and measure our impact. Because we knew what our plan was ahead of time, we were able to have a really high impact in a short period of time. However, without a maintenance phase, programs like this rarely maintain this stable state for the long term. And that's why ideally these programs are conducted ongoing by local organizations, not external organizations like us. Ongoing monitoring is vital for this kind of work. As of now, only one pregnant cat has been seen on the island, and they were one of the females who was purposefully kept inside by someone who was not in favor of sterilization. Therefore, the local municipality will now have to oversee this work going forward to maintain the stability of its island's cat populations. Having the support of the local municipality and collaborating across local animal welfare groups and vet teams was essential and is a core feature of any effective cat population management program. Thank you so much for joining us. Our contact details and social media is on the screen, and we would be happy to talk with you.
Thank you, everyone.